What we've designed is an insole with sensors that will measure how much force someone is putting on their injured limb, and it will alert the patient when they've exceeded their prescribed limit. So this will help protect the patient and speed up recovery.
It's important for healing that the bone gets a load or a stress, but it's also important that the bone doesn't get too much stress or too much load. As a therapist, I can kind of do that in my clinic. I can do that while I'm with the patient, but I have no way of knowing that they're going to follow through with those rules outside of my office, outside of my eyes. And so it's very important that for the patient's safety and also for the bone to heal correctly and appropriately, they are doing what they're supposed to.
Roger Williams does a really good job preparing us by having us do these group projects. Also thinking about the real life constraints, because when we're doing homeworks or projects, a lot of times it's theoretical, but for this we had physical restraints that we had to work around.
When we graduate and we go into the workforce, we're not just going to be having these handwritten calculations that we pass into our teacher that kind of go away. It's something that a customer or consumer is going to be using. So our client, the physical therapist, really wants to use this in our clinic. So we have a real life product that we're able to send out the door at Roger Williams.
No one wants to walk in a boot, but eventually, unfortunately some circumstances happen where you have to, but the eventual goal is always to get you back into a normal shoe, back into your normal life.